Hi, welcome to the Bari Nation podcast, where we support the bariatric community with humor, humility, and honesty. I'm April.
I'm Jason.
I'm Natalie.
We are welcoming to the podcast a brand new guest, somebody that you have never met before, but someone who we are very excited to introduce you to, Dr. Matt Weiner. Hi, Dr. Weiner.
Hi, how are you? Thanks for having me. Great to be here.
We are so excited. Our friend, Laura Grabo, introduced us to each other, and it has been serendipitous. You and I've had a wonderful time getting to know you just on some phone conversations, and we are very excited to dive into this conversation with you today that's really going to center on kind of two big things, big questions that really come up in our lives post-op, and we think about pre-op. How do we eat successfully after bariatric surgery? And then weight loss medication after surgery. We know you are an expert in both of these fields. You have written 3 books on the subject. I'm holding 2 of them here now, and you guys, this cookbook is amazing. All of your books are amazing, FYI. Last weekend or 2 weekends ago over the 4th of July, I had these sitting out, and my non-bariatric friends deep dove into them, and we had an hour-long conversation about our metabolic thermostat.
I got to hang out with you. I mean, that sounds like an amazing July 4th.
It was off the chain, let me say.
It sounds crazy.
Crazy. It was wild.
Pumps were called. It was a wild night.
Wild night. Yeah. But it was so interesting because, weight is something that I think most people struggle with. Bariatric patients, live that struggle on a different level. We've undergone a type of physical surgery, to help us live at this happy, healthy weight. But to engage in that type of conversation where we're really talking about the disease of obesity and weight management with people that don't necessarily struggle with that was fascinating, because all of a sudden we were kind of speaking the same language. Yeah. Right. And that's important as a patient, with people who haven't gone through it. So if you are looking to just dive deeper into the disease of obesity and bariatric surgery, I highly recommend that you purchase his books. They are on Amazon, FYI. So before we dive into the conversation, I would love to give you the floor, Dr. Weiner. Will you just introduce yourself to anybody that doesn't know you yet?
So my name is Matt Weiner. I'm a bariatric surgeon. I currently live in Tucson, Arizona. I've been practicing here for about 3 years. I was in Detroit for about 12 years prior to that. I'm really passionate about nutrition. I've written a few books on both nutrition and also patient education. I think that's what I'm most passionate about. I think bariatric surgery is amazing, but you really have to understand what you're signing up for. It is not a tool to be taken lightly. And I think one of my real commitments to my patients is to make sure that they have every tool necessary to make the changes to get the most out of the surgery. You're giving up 2/3 of your stomach, or you're letting a surgeon reroute your intestines and accepting some of the negative things that can go along with that. We have to make sure that you get as many of the positive things, as much positive out of that surgery as possible. And so that's always been my goal. And that's really driven me to write my books and to make the videos. And, it's all kind of just happened organically, really out of a drive to take care of my own patients. That's how it started. And that's how I really am continuing even 15 years later.
And it's amazing what you have been able to create, not only for your patients, but for the greater bariatric community. When I was first introduced to kind of your system or your methodology or what you believe in, it is a departure from what my own surgical center provided me. And while I think sometimes that can cause me a little bit of anger, I also just have to recognize that, everybody has a way of doing things differently. I'm a teacher, and how I teach is not how my colleagues teach. So, right, and the science of obesity, I guess, just seems so new. We're discovering new things, every day, every moment. It feels like there's these huge advancements that are being made, in this field. And, the more we know, the more we grow. And there's nothing wrong with seeing how other people are doing it. And your patients have had what appears to be like huge levels of success doing things a little bit differently. And that's kind of what we want to talk to you about today. You have the pound of cure, eating system. I don't know if that's like the best word, but
as good as any.
Right. Yeah. It's a bariatric diet unlike any I have ever seen post-op. And you are also this huge champion for weight loss medication before and after surgery. And when you and I had that initial conversation, it really blew my mind, but really it forced me to look at my own preconceived notions about medication after surgery. And after talking with Jason and Natalie about it and about my struggle and our struggles, this is something we are very interested in learning more about. So if you guys are ready, I say, let's just dive in.
Let's do it.
Go for it.
All right. So before we really dive into the conversation, Dr. Weiner, we would love to know, why did you enter the field of bariatric medicine?
So, again, like most things in my life, kind of fairly just kind of randomly, I actually did not do a bariatric surgery fellowship. I started off, and there was one of my partners was doing bariatric surgery, and he needed someone to help him, assist him during the surgery. And I was just getting started. I said, sure, I'll give it a shot. Why not? And so I immediately fell in love, honestly, with the surgery. The surgery is really challenging. A gastric bypass in particular. I saw that surgery and I was like, wow, what an amazingly brilliant surgery. And I also saw the potential to really do it very well, very safely. And I still, to this day, 15 years later, love that surgery. I mean, I did 3 of them today and I enjoyed every second of it. And so that's how it all started. Honestly, it was just for love of the surgery. Just I saw so many things that I felt like I could be good at in terms of just the kind of step-by-step repeatability of the procedure. And then also I started getting to know the patients afterward. That's really where the hook was set, was, with general surgery, it's like, oh, you have a hernia, I'll fix your hernia. Oh, thank you for fixing my hernia, doctor. What was your name again? And that's kind of how a lot of general surgery works. You don't develop these long-term relationships. But through bariatric surgery, I saw that I could develop long-term relationships with people. And, you get someone to lose 100 pounds and they will remember your name. I've had people tattoo their name on my name on their body. Yes. I am finer because of Dr. Weiner.
Oh,
yeah. So,
my God.
That is the best tagline.
So I mean, that level of gratitude, being able to make that much of it, and she had a lot of tattoos. So that was just one, but nonetheless, being able to make that much of a change in someone's body where they really feel like you have put them on such a better path to get so much more out of their life. That was when I was like, oh yeah, I'm in for this. And I just kind of started helping out with the surgeries, and eventually I kind of did them myself. And then, 3,000 surgeries later, here I am.
I think what is so special about you and a lot of surgeons that we've started to really have these conversations with is you can feel the excitement coming from you. And I think that, I know that translates to the patient when they're sitting in your clinic, about to have this surgery. I mean, we all know I've had 3 bariatric surgeries, 2 of which medically failed on me. And I remember my first surgeon's name, and I remember my most recent surgeon's name. We don't forget that, because those are huge, monumental moments in our life. But I think it's incredible, and it says a lot to you that they do remember you and they do have that sense of gratitude towards you. I think that's
thank you. I appreciate that.
Yeah. There seems to be a very distinct, way to classify surgeons. And it seems like there are surgeons that move through the procedure. They do it deftly, right? They keep their patient, they make their patients well, but then they're kind of done. And then there's the surgeons that are like, nope, I'm in it to win it. I'm finer because of Weiner. Like that level, that is like a whole new level right there. But that is the level that I think patients need. And while surgeons are probably not prepared for that, it's so refreshing and just inspiring to see surgeons that are doing whatever they possibly can be to be prepared to walk with their patients kind of, through the rest of their lives in their recovery. because this isn't just the one and done, okay, see you later.
Yeah. I think one thing that I've been really pleased about as far in our national society, I've gotten to know a lot of other bariatric surgeons. They in general are very good people. And I think I am much more the norm than the exception in terms of the commitment to long-term care, the long-term relationships. I think there certainly are surgeons who are like, I work for the hospital. I will show up when you tell me to do the surgery. I will do the surgeries, and I will let my nurses and dietitians and everybody else handle everything else. And those people definitely exist. I won't deny that by any means, but there's so many of us out there. I mean, this is not just a few people out there who kind of practice like I do. There's a lot of people who practice like I do. I think in every town, there's probably a handful of surgeons who really have a deep commitment. I think one thing that you can look for is the private practice surgeons, as opposed to the hospital employed surgeons. Yeah. They went into private practice so they can control the whole thing, so that they can really be in charge of their patient's entire experience. And so that if you're out there looking for surgeons and kind of looking for that comprehensive approach, often private practice is a great place to start.
Well, I also kind of feel like the level of excitement from surgeons is starting to kind of manifest with the way surgery is kind of changing and the backdrop is changing. I think it's kind of ever evolving the same way. And I think that the more people see, the more surgeons see people like you guys and the group that that are, just as passionate as you are, I think that kind of breathes new life into those people that have kind of been doing it forever. And it's like they're, it's kind of like somebody who just legitimately does knee replacements all day long. At the end of the day, you're like, okay, yeah, another knee replacement. Oh, woo, Yeah. And it's really kind of, once you get around somebody else that has the passion and the fire for it, you kind of start to look at it in a different way. And I think a lot of surgery centers, like you said, the private practice ones are the ones that really kind of keep those relationships alive, because I had mine through a hospital and my doctor was very much like that. He was amazing to get me through to the end of the day. He kept me alive. Awesome. That's all I want in a surgeon. Cool. But then he dropped me off to his PA and a dietitian and was just like, all right, I'm going to take it easy. Like, I never would have saw him again if I didn't bump into him in the hallway one day and he saw my progress when I was going with my wife when she was in her pre-op. Was the only way he ever saw to even see what I was doing. Now, he was jazzed about it when he saw me at that time, but it wasn't something that he routinely wants to be involved in after the fact. So I think your approach to it is really a lot better and says a lot about you and the other surgeons like you, because that's really what most patients want. Like, this is one of the scariest parts of their life. In a lot of ways, you save patients' lives, because I know for myself, I was actively dying when I had my surgery at 44 years old. So he saved my life. So to have him want to be involved in the aftercare and recovery would have been monumental to me. And I think that really does serve patients a lot better to have your approach versus somebody who's just going to be like, well, the check cash, take it easy.
Yeah.
Yep. Well, I think too, as our community grows and as more patients speak out about their experience pre and post-op, I think there are a lot of doctors and a lot of surgeons looking and understanding now that perhaps the pre and post-op care that they were offering was not adequate, right? When all of a sudden you've got, hundreds of thousands of patients going, I need more, XYZ, there are a lot of people who are listening and watching and are pivoting, which it sounds like that's really kind of what you have done with your own system, right? And practice, is that you realized your patients needed something different and you worked very hard to create something different for them that was tailor-made for what they were going through and experiencing.
Yeah. Well, truthfully, my patients created the program, not me. I mean, it was really the science of obesity and then listening to my patients that allowed me to kind of create the program. So right around the time, right before I wrote the book, some really great studies came out that talked about your set point. And that's the metabolic thermostat. We may as well kind of jump into that if we can, if that's all right.
Yeah. Oh, yeah.
So your metabolic thermostat basically says your body has a set point And when you starve yourself, you restrict your calories, your body revolts against that starvation. It works to protect your fat stores. And so it increases your hunger and decreases your metabolism, which is why we plateau when we calorie restrict. And so the most effective way to lose weight is not to fight against these inborn mechanisms that defend your fat stores, but instead to lower your set point to a new lower number. And it turns out that's what bariatric surgery does. You go to sleep at 300 pounds and you wake up and in your brain, you're 200. And so what I saw was that my patients were in this hormonal state where the opposite was occurring. They weren't defending their fat stores. They were trying to get rid of their fat stores. So their hunger was decreased and their metabolism was increased. And it's not just hunger, it's also the foods that you choose. Some foods cause weight gain, some foods cause weight loss. And so I started listening to what my patients were saying. Hey, doc, this is crazy, but I love fruit. Have you tasted the peaches this year? The peaches are amazing. And they were good. I mean, I love peaches. Who doesn't love a good peach, right? But they weren't any sweeter than ever. But they're like, I've never tasted fruit that's so sweet. And their taste buds were changing. And so they were telling me the types of foods that they like to eat. And it turned out it was fruits, vegetables, nuts, seeds, beans. Animal protein was kind of I can take it or leave it. I eat it because they tell me to, but it's not really what I'm driving to eat. And so I kind of assembled that and started looking at some of the nutritional science behind it. And that's where the whole Pound a Cure program came from.
That is fascinating that you really paid very close attention to that, because I know like all three of us, our taste buds changed after surgery. There are some animal proteins that we just cannot handle. Yeah. And I don't think my surgeon knew that about me.
No.
Right. So when you're talking about this set point, so surgery resets the set point, is it forever or temporarily?
That's that is the $1 million question. I think, for some procedures, you're going to get more durability than other procedures. I think we're seeing more weight regain early on after a sleeve than we do after a bypass. I think to some degree with all of these procedures, there is a little bit of upward drift. It's complicated though, because is it just the surgery wearing off, or is it other factors that contribute to set point elevation? So we think like, oh, your set point, is it just something that magically goes up, or it goes up because you eat too much, processed food? It goes up because of sleep deprivation. It goes up because of untreated stress and depression. It goes up because of medications, huge cause. It goes up because of alcohol overuse. It goes up because of an injury and muscle loss, or aging and muscle loss. So there's a lot of things that contribute to your set point kind of going up or down. And so the same things that contributed to your weight gain before surgery contribute to weight gain after surgery. And you really have to take a comprehensive approach and identify all of those things that may put you at risk for weight gain after surgery.
I feel like you are speaking to me directly and calling me out all at the same time.
I'm not calling you out. This is hard.
Oh my.
Yeah.
I'm sitting and listening to it and being like, damn, man, it's all me. That's so.
I know, Jason, you were doing that math too. I could see it. And I was like, oh, yeah, it's all the.
I'm not even good at math, and I was doing that math.
I mean, we've talked to a lot of surgeons. We've talked to a lot of experts in the bariatric world, which is amazing. And we've heard consistently from them that there is this 10% bounce. When you get to your low weight, your body's just going to want to come back up a little bit, right? It's extreme. You can expect to regain 10% of like the weight that you have lost. Okay, fine. But I'm experiencing regain above and beyond that. Jason is as well. And I certainly have reincorporated alcohol. I am eating more. I'm eating different foods. I'm eating past full, like all of those things. I am doing that. Yeah. And it's frustrating that, again, surgery doesn't fix this, it fixes this. And the strongest effects of surgery, right, are really kind of within that 1 year. And as soon as you kind of open the door and you welcome these things back into your life, you're going to be struggling with the same thing because it's the same thing, right? We're doing this. Yeah. So from my understanding, the Pound of Cure is really a bariatric diet that is different from what is mostly prescribed. And that is, now again, like I read your book 3 times, but it takes me a while to kind of get through this stuff. But really the premise is that you want to eat a pound of vegetables a day.
Yeah, that's kind of the essence of it. And it's really about eating as much healthy food as you can and as little unhealthy food as you can.
Yes.
Which is different from just not eating, which is kind of the general philosophy behind a lot of diet programs.
Yes. Well, and especially right for bariatric patients, it's eat all the protein.
Yeah.
And if you have room for these other things, then do these other things. But what you're seeing is that maybe that should be flipped and reversed.
Well, I think it's a little more complicated than that. You have to look at the stages of recovery from surgery. And I think you just outlined them, right? You right after surgery, you're like, oh my God, what just happened to me, right? And you're like, oh, let me take a sip of protein. Right? It's hard. And at that point, starvation is a real risk. Malnutrition is real. And so that is not when I have people eating a pound of vegetables. I don't want anybody out there listening thinking, oh, I'm 2 weeks out from surgery. Bring on the pound of vegetables, right? That's not how we do things in our practice. That's the recovery phase. And the recovery phase is protein shakes and soft foods. And it usually lasts somewhere between 1 to 3 months until you can eat fairly comfortably again. Anybody who's post-op will remember those days pretty clearly, I'm sure. And then you kind of enter the honeymoon phase. And that's where you have no hunger. Life is wonderful and you're losing weight fairly rapidly. And I think when you're losing weight, I don't necessarily push the pound of cure approach. I push what everybody else pushes, which is more of a high protein diet, because I think eating at least 60 grams of protein, maybe even 80 to 100, depending on your gender, age, and size, is probably in your best interest in that rapid weight loss phase. But the truth is, in the grand scheme of a bariatric surgery patient's life, this is a very brief moment. And the weight loss starts to plateau often around 6 months out from surgery, generally completely stops by a year. And it's once it really starts to slow down, I kind of ask my patients the question, do you think there's any chance you're going to starve to death? And everyone's like, no chance at all. I'm fine. I can eat plenty. Like, I want to lose more weight. Let's talk about more weight loss, right? And so at that point, don't focus on a high protein diet, because a high protein diet is probably not your best weight loss diet, right? Especially animal protein. Let's think about what protein shakes are. They're artificially sweetened, artificially flavored, processed animal protein. That's not necessarily what I would describe as a healthy food. So once you kind of hit that inflection point where you can eat comfortably, your weight loss is starting to slow down. You want more weight loss, not worried, oh my God, how much am I going to lose? This is never going to stop. That's when I start transitioning patients gradually over to a more nutrient dense or pound of cure like diet. So I think it's important to understand that this has to be a transition. And the problem that most surgery programs are run by surgeons, and surgeons have in general a fairly short attention span. We're trained, do the surgery, get them recovered, move on to the next patient. And that sets itself up for counseling patients to eat a lot of protein, because that's going to get you through their surgery. But what we're not trained about is lifelong nutrition and weight loss. No doctors are, truthfully. We're starting to see a little bit of that now, but nobody who's even a little bit experienced in medicine got any nutritional training during their medical school or probably residency. And so now, that you have to kind of figure out on your own. And that's what's missing from a lot of programs is, hey, at some point, this diet we told you about isn't the right diet for you. There's a better way of eating. And that's what the pound of cure is.
When I read that,
we were never told that. We were told 1,200 calories for the rest of your life, and 48 ounces of water and 60 grams of protein. Have a good time.
Yeah.
Well, when I think back to about my pre-op diet, I was probably eating a pound of vegetables a day.
Yeah.
Because I had to shrink my liver. Like, I just connected those dots of I was eating, 3 to 4 ounces of protein and as many vegetables as I could get on my plate, because that's what I could eat.
Yeah.
And I've always loved vegetables and fruits and all of that. So that makes sense to me. But I think it's that shock of like, can I actually eat that? Because we're bariatric patients and we're like told that we're supposed to eat these tiny portions. And like you said earlier, I think that that's more focused on the up to that year mark. And so that information, we don't have the information for like the beyond.
Yeah, that's why what you guys are doing is so important, because, you know, to some degree, we've let you down as a surgical community about what's after year one.
Yeah. I mean, even my mom, like having conversations, like family, friends, like, oh, you can eat all of that? And I'm like, yeah, like I'm eating like on a normal plate. It's not piled high. It's just
and
like,
and then the next comment is, well, Nat, you ate through your staples, or you stretched it out, or right? It was something you did.
That is the word.
You did this. You made a decision and you were the one who caused this, rather than this being the absolutely natural progression of eating after surgery.
Right.
You didn't do it. Every single person who ever had surgery developed an increased capacity for food over time. That's what happens.
Right.
I feel like we just had a religious experience.
I really did. I'm like, hello, I can still eat. And it's nice, I think, for myself, and I know for April and Jason too. It's like, it's almost like a freedom to be like, I can have all of these vegetables. Like it's okay. It's like giving yourself that, I guess, I don't want to say permission, but like freedom to have like a normal size plate.
Yes. Yeah.
Well, and what for me is just so like interesting, and I don't know if this was in a phone conversation you and I had, Dr. Weiner, or reading it somewhere, but it was just like, we have been told to eat this very strict kind of, not rigid, but you know what I mean? Like protein, if you have room, you know, complex carbs, healthy veggies, all that kind of great stuff. Right. But, you know, I'm almost 3 years post-op, and while I don't follow that religiously, I follow it pretty closely. Now, granted, I'm struggling with overeating. Okay. And I'm seeing the scale go up, but I am very curious what would happen if I just switched that up, because when you and I were talking, we're like, well, who has actually lost weight following one of these diets that has nothing but like shakes and all this kind of stuff? Like, yes, you'll lose weight, but it comes right back.
Yeah. Yeah, because you're not moving the set point, and you're not doing something that you can maintain.
Exactly. I mean, when you said that, I was like, oh my God, it was just all of a sudden like the veil had been pulled off, and I was just a little bit shocked and also a little bit angry. Like what you said, as a patient, I think I went into bariatric surgery thinking my surgeon and that surgical team was going to give me everything I needed to be successful.
Yeah.
I got nothing. I survived. They did a deft job, right? Like, whew, beautiful staple, like, oh, whew, those scars are minimal. You know what I mean? And I'm alive.
Yeah.
That's the most important thing. The scars,
that is,
you know, we can deal with scars, but we
can deal with that. Right. But I was just so angry, and I don't remain angry, but that is that kernel of anger is what drives me and Bari Nation. We did not get what we needed, and we are on a mission to discover what we need and then make sure that every flipping patient has access to it, whether or not you take that, but at least you have it. And this eating plan, this eating system, this eating philosophy is just such a departure and so different from what we have been given. And it kind of goes into my next question about it. So does this eating plan help you maintain that lower set point, or does it like help lower the temperature?
So I think the way I kind of break it down is I talked earlier about some of the things that can cause your set point to go up: sleep deprivation, injury, medications. The way I see it, there's 4 things that can cause your set point to go down. And what we're really dealing with is these kind of things that pull in opposite directions, right? Life, age, injury, medication, sleep deprivation, they pull your weight up. So what can we do to kind of anchor it or pull against it? And it turns out there's 4 things, and they are nutrition, but it's not eating less, it's eating different types of foods. So you eat more foods that are protein, that are fruit, vegetables, nuts, seeds, and beans, and lean animal protein, and you eat less processed, sugary, artificially flavored, artificially sweetened foods. And it's really about this balance. I kind of talk about that as your calorie ratio, where the ratio of good calories to bad calories. And so if you can shift that as much as you can toward good calories, because that's sustainable, because you can address your hunger. You don't have to walk around hungry. You get hungry, you eat. You just eat healthy food. The next thing is exercise, but it's not exercise to burn calories, it's exercise to build muscle. So it's weightlifting. I think spinning is great because you actually do build a lot of muscle in your legs. That's where most of our muscle is. I see it. So building muscle is another way that you can lower that set point. The third one is weight loss medications. And, we'll talk about that in a little bit, that there's the first generation weight loss medications, which most people have probably tried, but we now have a second generation, and it is a very, very different experience. And then the fourth thing is surgery, whether it's a revision surgery, if you've had a sleeve, moving on to a SATI, or even a duodenal switch, or a gastric bypass. With gastric bypass, there are revision surgeries. I'm not a huge fan or proponent of them. I think the juice to squeeze ratio isn't there. It's a lot of risk and not a lot of weight loss. But revision surgery, additional surgery for weight loss is kind of the fourth mechanism. And so it's really about living your life after surgery, trying to minimize the things that cause the set point to go up, and embracing as much of the things that help the set point come back down as you can. So yeah, eating or following the Pound to Cure program kind of will lower your set point a little bit, not a ton. It helps you, it puts you a little more resistant to weight regain. There's many factors that cause it, not just what you eat. Most patients, when I see them in the office and I look at what's going on with their weight regain, I mean, yeah, are their habits perfect? No, but neither are mine. I think perfection as a goal is unrealistic. And so, yeah, I mean, they could do a little better on the nutrition, but is that the primary reason? No, it was the med that they got put on that they didn't even realize caused them to gain 30 pounds. It's like, when did you start gaining weight? About 18 months ago. When did you start taking that medication? About 18 months ago. And like, yeah.
Well, and just looking at this list, right? So the 4 things: nutrition, building muscle, weight loss, medication, and surgery. As a patient, I mean, we can already check surgery off the box, right? And then for the most part, and then the 2 things we very much are in control of. I think a lot of times we feel like everything is out of our control and just, everything is crazy, especially when you're post-op and everything is scary again. But nutrition and building muscle, those are kind of 2 like, oh, okay, I can do those things.
Yeah. Sometimes. Right?
Yeah.
There's socioeconomic issues, there's injuries, right? And, we don't cut ourselves some slack for recognizing that there are a lot of barriers that keep us from behaving perfectly the way we think we should. And
well, Jason, you've kind of experienced this. You have been very motivated to move more, and you've faced some setbacks recently, and that's been really hard for you.
Yeah, I had really been going hard in the gym and I had a whole routine down, was doing 5 out of the 7 days, really had a whole program going, was starting to see a lot of good results, building a lot of good muscle, and then figured out that my blood pressure was a problem, and my doctor didn't want me going until I could get my lower number under 100, because there was a lot of times I was sitting between 115, 125. And she's like, you don't need to be going and do it. Because I was super excited because I went to my appointment and I was like, I ran on purpose today for 2 minutes straight, ran like I've never done that. I don't care if something's chasing me. I don't run. I run late for dinner. I run out of water. That's it. Those are the 2 things I run. And I was super excited about it. And when she took my blood pressure and was like, yeah, don't do that. And I'm like, I was crushed because I was like, starting to see all these gains and I was really, really killing it. And then she's like, "Hey, you can't do that until we get this figured out." Well, it was that this was at the beginning of the year.
Yeah.
And I just now went back to the gym today for the first time.
Yeah.
And because it took that long to get everything situated. And I can't say the whole thing was getting the blood pressure situated, because we got it situated about 6 weeks ago. And my grandbabies were here for 6 weeks. So I was with them, and I blew everything off until I could get them going and get back on my actual routine. So that started today. But yeah, and knowing just a little bit of time that the strides that I had made to build what I had built and the little bit of time away from it I've spent, like going back today, I'm not going to say it was harder on me because I had lost a lot of the progress that I had made, because I knew that was going to happen. But the fact is I can still lift heavier than I would have when I was at my heaviest. I can still, walk on the treadmill at an incline at a high rate of speed, and it doesn't bother me. Like, I can still do the things, a lot of the things that I could do, even though I've put on about 35 pounds. So.
I just want to give you credit though, because your grandbabies being there for 6 weeks is still activity and movement.
Oh yeah.
Not traditional.
It definitely was.
It is also very important.
Yes.
Right. Well, and that kind of goes to, the barriers, and barriers does not always mean negative. Barriers just means something that is taking you around a different route. And sometimes that time that we're spending with family, the time, all of it is things that we do need to factor into our lives. And what we've been focusing on this summer is about how do we stay steadily aligned to our goals. And when these barriers appear in our life, if we just cannot hit this one thing that we've been doing, there are other things that we can do to maybe compensate or offset, or just be okay with pausing that until we can find that workaround. So to have such a very clear, hey, here's the 4 things that you can do to stabilize or help creep your set point back down again. It's a very easy, it's a simple list. It really is. And I know that with your eating plan, it is a very simple eating plan. There's not a lot to it. There's some guidelines and, hey, eat this and do this for 2 weeks. And then you're moving on to this next station. And then it's this and this and this. And it's just very different from any of the post-op eating, recommendations that we've gotten. So the other thing that we wanted to talk to you about today is weight loss medication.
Yeah, very exciting.
Yeah, what the heck? When you initially talked to me about this, I was blown away. I was a little bit like, oh, but I've had surgery, so why the heck would I need medication? And I'm just the idiot, all that negative self-talk instantly came into play. But this is a whole new world in medication.
These are really pretty revolutionary. They're the single biggest change in the way we're able to treat obesity since bariatric surgery.
And what makes them so different? How have they changed?
So first of all, these, I call these second generation weight loss medications. And I think that distinguishes them from phentermine or Adipex or phendimetrazine or metformin or Contrave or Belviq, which, that's now pulled off the market. And those medications have very, very modest weight loss results and some decent side effects. These have really not a lot of side effects, extremely well tolerated, and they work very similarly to the same way that bariatric surgery works. So what causes your set point to go from 300 pounds to 200 pounds overnight after bariatric surgery? When we reroute your intestine or we remove a portion of your stomach, we change the way your gastrointestinal hormones flow. Now, this isn't like testosterone, progesterone, and estrogen. This is insulin. This is ghrelin and leptin. And it turns out it's glucagon-like peptide, which is GLP. And that's one of the hormones that regulates your fat storage, that regulates your appetite. And by injecting an analog, something very similar that triggers the same receptors as GLP-1, we can initiate some of these same hormonal responses after surgery. And so I talked earlier about that honeymoon period when it's so easy to control your appetite, and you're motivated and weight comes off effortlessly. And it was just a magical time in anybody's life, I think, who's had the surgery. These meds kind of bring that back. So as time passes, the impact of the surgery starts to wear off a little bit. I have had the most overwhelming comment I get from my patients is, it's like I just had the surgery again. That's how I feel. Yeah, April's like,
I think you can sign all of us up. We'll take 20.
Where do I send my insurance information?
Yes.
I mean, it's just, I mean, this literally, I had to write this down. I was like, right, okay, so, set point lowers when we change our hormones, right, work in our bodies, blah, 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 blah. And then, surgery does that instantly. Well, then you just so do these medications. They literally do the same thing. It's just surgery is physical, whereas these medications are not. So it's almost like as a patient, you have a decision before even surgery now, depending on how much you have to lose or whatever your life situation is. You could achieve the same amount of weight loss now with medication.
It's a little less on average than surgery. There's kind of, I would say there's like weight loss meds, then sleeve, then bypass in terms of the amount of weight that people lose. And then steady or duodenal switch is even more. And the meds are a little less, and it depends on the meds, Wegovy or Ozempic, which is kind of the gold standard at this point, is a little less than I think what we see from a sleeve on average, for sure. A new med that just came out, which is only approved for diabetes, but is definitely going to become approved for weight loss very soon, called Trzepatide. This has been FDA approved for weeks. I think my PA just wrote her first prescription a couple of weeks ago. That is pushing what we're seeing with sleeves, 20, 25% total body weight loss. So you're 200 pounds, we're looking at 40, 50 pounds of weight loss.
Oh my God.
So, yeah. I mean, so we're starting to, we're a little less, but we're starting to threaten it. There's another one coming out as well. It's probably going to be right around where Trzepatide is. I don't know the name off the top of my head, but yeah. So
you have bariatric patients that have undergone surgery and they are using medication at the same time to maximize weight loss and to maintain that weight loss.
Yeah.
Correct?
So first of all, brave new world here. Like, we're making this up as we go along. I can't open up the journals and say, okay, here's how you prescribe these medications in coordination with bariatric surgery. These articles do not exist. What we're kind of, I have a fantastic team, and we talk very regularly about what we're doing and how we're using them, and I had this patient and this is what happened, and another patient, this is what they experienced. We're working, if someone's diabetic and they're planning on having surgery, then I'll say, let's get you on this med right now because we can get it approved for your diabetes. And we'll keep you on it through surgery, and it'll help with your post-op weight loss as well, and give you a tool to help you maintain your weight. So we're starting to we're kind of, making it up as we go along. It's not like there's some scientific guidelines. The science is very real behind the meds. I mean, these are New England Journal of Medicine articles, which is the highest level of scrutiny. And if something makes it in the New England Journal of Medicine, it is in general a very well done, well-researched, large study. They did the science right. So that's where these articles with these meds are being published.
Well,
so the science is there. It's how to use them that we're still figuring out.
I think that's just so brilliant, because that's what we have learned within the last 10 years about bariatric surgery, that it's not strictly the restriction, but it's the hormones and the gut and the bacteria and how they all work together.
That's
and medications are targeting that instead of the hunger or the restriction or whatever. It's amazing.
Well, and that was kind of my question when it comes to this medication. I've never been on any type of weight loss medication. does it help address the hunger that returns after surgery, or is it strictly the hormones, but then the hormones are responsible for the hunger? Is that kind of the order of operation?
It's a hormonal treatment, but the net result, the experience for the patient is less hunger and much easier to satisfy hunger. So you're like, I'm really hungry. I'm going to eat a small amount of food and feel very satisfied. Again, like you felt after surgery.
April's about to jump through.
All right, hold on, April. Let me put up my computer. I'll send over a script for you, okay?
So
What's your pharmacy info? Give me your pharmacy.
So you mentioned Ozempic, which is one of the things that my primary care physician prescribed to my wife before she had bariatric surgery to kind of help with weight management. And it didn't really work that well for her at that point because she hadn't had the surgery yet. So
what dose was she on?
I couldn't even, honestly, I couldn't tell you. I just remember Ozempic stuck out to me because she was taking them, and it was a shot that she took in her stomach. I remember that part.
Mm-hmm. Yeah, it's a weekly shot.
Okay, so it's a weekly situation. Okay.
Yeah, so with what we've figured out with these meds is it's all about the dose. So the dose that they've been using, so let's take Ozempic, which is kind of, again, the gold standard. So for a very long time, the standard dose of Ozempic was 0.5 milligram. And you would see, 10, 15 pounds of weight loss from that in some patients, not everybody. And you'd see some pretty modest reduction in your A1C. And it was a nice adjunct. Maybe we could keep someone off insulin for another year or two. It was a little incremental move forward. And then they thought, well, let's go up on the dose. Let's see, is 1 milligram going to be safe? Turns out 1 milligram's perfectly safe. And we lose a little bit more weight. We're starting to see the A1C come down, and we see a very clear dose response. The higher the dose, the better the response. More higher dose, more weight loss, more lower reduction in your hemoglobin A1C or improvement in your blood sugars. And so then they basically were like, well, let's really ramp this up to 2.4 milligrams, and that's the full dose of Wegovy. And that's where we really start to see 40, 50 pounds of weight loss, very significant weight reduction. And so it's possible if you've tried one of these meds before, first of all, a lot of the other GLP-1s aren't as effective in terms of weight loss as Ozempic. And why that is not fully understood. I think a lot of it may have to do with just dose, right? Ozempic is just probably dosed higher than most of these meds. And it also sticks around longer. It's a weekly injection. Probably the half-life of it is even longer than a week. So you take it and it's on board for a while. And so how you dose these, how you kind of help patients manage their nutrition. It's not just a give me the shot and that'll satisfy it for me. It's give me the shot. Let's talk about nutrition. Let's dose it appropriately. Let's adjust your other medications. There's a lot to this. And so that's really what you have to do in order to get the best effects from this.
Yeah, I think that's important to note. For anyone listening, is there's still no magic pill or syringe or surgery. This is amazing, I think, and this is like a huge breakthrough, but I mean, you still have to work on your brain.
It's a great tool.
Yes.
And just like bariatric surgery made losing weight easier, and also initially made getting your mind set about food easier, these meds do that same thing. Mindset is critical, but it turns out it's a lot easier to change your mindset on these medications. And so is it the medication? Is it the mindset? It's both. And you can't, it's when you use all of the tools together, that's when this all works.
Well, and that's, we talk often about, taking the things that you can and building your bariatric toolbox so that when those things happen, and that involves mindset, that involves metabolic wellness and movement, all these things, and being able to, adjust on the fly when you feel like these things are coming on. But having another tool to add to the toolbox like medication it is, it's just that it's an amazing tool that you can add, just like the surgery was. So using those in concert with each other, as long as you're still doing the other work on your mindset and those other things, like you said, it just makes it easier to do, but you're still doing it. And that's that's kind of the beautiful thing about this, is it's all in concert with each other.
Yeah.
I mean, I would give it, I mean, oh my God. I just, and I can only equate this, like my marriage is amazing, period. The first year of my marriage, however, that honeymoon year was the most glorious year of my adult life.
Yeah.
You know what I mean? Like, it was stunningly amazing. The first year after surgery for me was equally amazing. It was rough. There were rough patches, but that is when I had my biggest aha moments. But it's because my brain was not all the time occupied with food. Yeah. Or hunger, or satisfying hunger, or, like, I could dedicate my brain power to the heavy mental lifting that I needed to do. And now that I'm almost 3 years post-op, I'm back to thinking about food all the time.
Yeah.
And it breaks my heart, because it's not that I didn't learn, or it's not that I'm not using those tools. It's that it's back again. And I'm so tired of it. I am so tired of feeling like I am living my life in an endless loop.
The tools feel heavy.
Yes.
Before it was easy to use them.
Yes. Right. Yeah. And I feel like, I mean, you guys know, you two know, I just moved into my big new beautiful house, and I feel like I'm looking at a completed house, but I just can't move into it yet. Because something is not right. And I am missing, there's something that I'm missing. Maybe it is the nutrition. Maybe it is muscle building. Maybe it is movement. Maybe it is those things, but maybe it's medication. I just don't know, but I am just very tired of feeling this way. There's just a sense of restlessness in me that I cannot seem to shake. And the more that we talk about this exact conversation, the more we talk about, like, what tools could we be missing? What is missing from just the bariatric community? I mean, medication may be something that I need to try. I mean, Jason, you're on meds and you'll be on them forever. And that's just what some of us have to do.
Yeah, no, and that's true. And kind of like what you were saying, it could actually honestly be all three of the things that you need to incorporate that are going to get you where you truly want to be. It may not just be one or the other, because I know for myself, getting back in the gym is going to help. Adjusting my nutrition is definitely going to help, because I'm still protein all the, like, you know me, I'm eating potatoes minus the potatoes now. I grew up, I'm a country kid, and so I'm potatoes or meat all day long. Yeah. So to this point, I can eat 6 to 8 ounces of meat at a time, and I may have room for a little bit of vegetables after that, but I definitely need to adjust the way I'm doing it, because I'm still I'll clear out protein and not eat anything else.
Yeah.
I'm just like.
Yeah, I think, here's the thing, April. It's a journey. You're going to have good times. You're going to have bad times. You're going to think, hey, this is awesome. I've got this. And then you're not. And then you're going to have it again. Mm-hmm. And so it goes up and down, and you find things along the way, medications, people, experiences, foods, exercise. You just find these things along the way. They enter your life. You take as much advantage of them as you can, and they're all temporary. We're all temporary. And so I think it's so important to understand, like, wherever you are right now, that's just right now. That's not tomorrow. And so the meds, the food, all of that can change.
Yes. It is a journey. And I continue to rely on this, like, mountain metaphor that popped into my head a couple of weeks ago, right? Like, life is a mountain range. It is high peaks and beautiful vistas, and it is deep valleys, right? With a lot of darkness, and you can't have one without the other. And I'm just so thankful that I am a part of a community and I get to have these conversations with you and people like you, with Jason and Natalie, so that we can gather the tools that we need, right? That we can have that information at our fingertips, that actionable information at our fingertips, so that we can use our intelligence and use our strength to set our path right through this mountain range. It's frustrating because I feel like I should have this figured out by now. But space and grace to myself, like, nope,
not the perfectionist in April coming out. Never that. Well,
never.
And to go with your mountain range metaphor, that's perfectly placed. However, it's one of those things where we have to have the dark valleys to appreciate the peaks and the vistas. So you got to, and the exercise coming up from the deep dark valleys up to the vistas is what we need to keep us where we want to be.
Yeah. And also just the regular old flat parts. That's what I keep thinking about, is like, sometimes they're just like, meh, you're at sea level.
Right.
The overlooks that aren't that flattering. You're just kind of like,
Right. This is what it is. And I feel like that's where I'm at, is like, okay, this is where I'm at. I don't really have a view. I'm not cold and dark, but I don't really have a view, and I don't really have like a lot to look at, but I'm here. And I think that, everyone has said it very eloquently, that you just have to grow through it, right? Grow through what you go through, ma'am.
Right. Yeah. This has been enlightening. If you are not watching this, you probably should, because we all had some mind-blowing aha moments. Dr. Weiner, is there anything that you would like to leave our friends and our followers and our listeners with?
Well, first of all, I think that it's really important to understand that a huge component of obesity is physiologic and metabolic, and often outside of your control. And I think that is the thing that I just see misunderstood over and over and over. I'll see 10 or 15 new patients a week for treatment of their obesity. And I would say of those, probably all but 2 or 3 really look at their weight gain as their fault, their weakness. And so often I'll say, well, what do you do for a living? And I do this, and it's a pretty good job, and clearly something that has some responsibility, and some people, are you faithful to your spouse? Yeah, I'm faithful to my spouse. What do you mean? You have children? Do you take care of your children? Do you ever just not show up and not pick them up? No, I don't do that. I'm a great mom. I have a great relationship with my kids. And at work, you ever just decide, I'm not going into work today for like 4 days. I'm just taking off 4 days. I'm not showing up, I'm not telling anybody. No, I would never do that. I haven't missed a day of work in 2 years, So they're incredibly disciplined, except with food. And they think it's some like weak point, but it's not. It's just physiology driving this. So your inability to control your hunger, your inability to maintain your weight is not a sign of personal weakness. It's a sign of your biology. And you have to really start to look at it and approach it from that perspective first and foremost. And then once you have that understanding, then you can build all the other components on top of it. But I think if you're blaming yourself for your weight gain, and I'm not saying that there aren't things you can do better, there always are, but we're all human and we make mistakes and we do things very imperfectly. And so most likely you're doing things better than you think you are. And it's so important to maybe pause and say, here's the things I do right, and that's equally, if not more important. And I think that's something I would love for everybody listening right now, is maybe sit back and tell yourself 3 or 4 things that you are doing well when it comes to maintaining your weight. And remember that you're also doing that too, and that a lot of what you're experiencing is biologic, physiologic, and largely outside your control.
Well, let's practice what Dr. Weiner has asked us. What are 3 or 4 things that we're each doing well to maintain our weight or to live aligned to our bariatric goals? Nat?
I knew you were going to call me.
Matt, you gotta like put your head down. And, like, don't make eye contact.
Listen,
And she won't call
I'm
you.
going to force April to do it though too, because sometimes she asks everyone else and then she doesn't get herself. So we'll
So
make
it's a
sure.
skip out.
I have been meal prepping. I consistently go to therapy for food addiction. And I walk every single day.
That's amazing. That's more than 90% of people do, by the way, Nat.
Thank you. It's been a long time.
Jason?
I routinely have been, I'm making my water just has always been, I've never had a problem hitting my water goal. I continue to do that routinely on a daily basis, make sure I do that, taking all my other medications that I'm supposed to be taking. And I really have never, even though I wasn't able to go to the gym and like really work out hardcore, I really have never stopped moving around as much as I possibly can, doing as much movement as I could get in without straining myself and, you know, past my doctor's concerns. So those are the 3 things that I've been routinely faithful on.
Amazing.
I have been faithful to my vitamins from day one. Thank you, ProCare Health, for that. I continue to acknowledge that I don't have all the answers, and I seek out the support of my community and experts. And I always start with protein. Those are 3 things that I'm doing. Not perfect, but I'm doing them.
I think we sound pretty good. I think we're doing pretty amazing.
I think so.
We are, you know, and the other thing that I have to applaud all of us for is that we are publicly sharing our stories, our trials and our tribulations and our triumphs with the world in hopes that we will help other people in our community. That takes a lot of strength. That takes a lot of effort. That takes a lot of bravery. And we are saying enough is enough. We want a different path to treatment for our cure for obesity, and we are not going to stop until we get that. So we're on, Dr. Weiner, you're doing that with us. You are a part of that. That's
I'm happy to be a part of it. This has been great.
yeah.
Yeah.
Oh, well, we so enjoyed talking with you today. Where can people connect with you?
So first, my website, poundofcureweightloss.com. And then also Instagram, it's Dr. Matthew Weiner, Dr. Matthew Weiner. And YouTube, same handle, Dr. Matthew Weiner. I'm definitely gearing up to film a bunch of new videos, mostly centered around medications and also the newer surgical procedure, the SADI. But I first have to get our appointment system. We're kind of swamped right now with requests for appointments, and we installed a new appointment system and it totally broke everything. So if you are trying to make an appointment, please have a little patience with us while we kind of address that. Yeah, and if you get a notification saying that your appointment is tomorrow and you know you don't have an appointment, it's probably not really good.
So
That sounds like a good problem. Sounds like a good problem to have.
Yeah, we're trying to settle that. So, you know, that's my first order of business. Once I fix that, and then I'll start getting to the videos. But I applaud you guys for everything you're doing for the community. It is so important, so needed. You're really doing great work, and I just urge you to keep it up.
Thank you. We are dedicated. We are here for the long haul, and we will not stop until we either create and connect patients with the help and support that they need before and after surgery. We are, all 4 of us are aligned in that mission. Awesome. Jason, my friend, you want to take us out?
Yes, ma'am. Dr. Weiner, we can't thank you enough for your time, your knowledge, just being here with us today. It means more to us and our community than you could possibly imagine. So we thank you so much for that. And as the community, we just thank you guys so much for all the support, the likes, the shares, the subscribes, telling people about us, you know, turning people on to us, whether they're in the surgery community or not, even if they're just support people to other people that are in the community. That's also very important. Don't forget that you can also leave us ratings and reviews on your favorite podcast player, as well as our YouTube channel. And with the Anchor app, you can leave us voice messages that we can incorporate into future episodes. So that's just another way we get to shout you out, because, you know, helping you guys is monumental to us. We wouldn't be able to do what we do without you guys. So we just thank you guys so much for that. And don't forget, at the end of the day, you've got this, we've got you, and we'll see you next time.
Awesome. Bye, guys.
Bye-bye.
Bye.